The SWOG S1826 was actually initially presented at ASCO 2023 by Dr. Alex Herrera, and I presented at ASH 2023 the older patient subset. So these are patients 60 and older who were enrolled on the SWOG S1826 study, and they received, they were randomized, newly diagnosed advanced stage Hodgkin lymphoma to Nivolumab AVD for 6 cycles versus Brentuximab vedotin AVD times 6 cycles. And what we really found were that there were a lot of adverse events in the older patient population, more so than the younger adults with this treatment. In particular, the Brentuximab vedotin had more side effects compared to Nivolumab AVD, including GI toxicities like nausea and diarrhea, peripheral neuropathy, infection, sepsis. And actually a third of patients on the Brentuximab vedotin AVD arm did not complete treatment at the time of data cutoff, primarily due to adverse events. And unfortunately, 10% of patients actually died on the treatment of those getting Brentuximab vedotin AVD. And then what was really striking, not only was this new regimen, Nivolumab AVD, better tolerated, but it also had significant difference in progression-free survival at 1 year with a 12.1 month follow-up time. The 1-year PFS for Nivolumab AVD was 93% versus 64% for Brentuximab vedotin AVD. And the event-free survival was also statistically significantly higher for the Nivolumab AVD regimen. And as I've already mentioned, more patients died on the Brentuximab vedotin AVD arm. And so what I'm most excited about is that this is really appears to be a practice-changing data set. And I've already been using the regimen Nivolumab AVD for my patients who are 60 and older with advanced stage Hodgkin lymphoma. And I think it's really going to become a standard of care for patients who are able to tolerate chemotherapy-based approaches for Hodgkin lymphoma.